Hello, my name is Anna Hanson. I am a clinical associate professor at the University of Texas at Tyler, and this is my presentation for the Qualitative Research Conference. I recently completed a classic grounded theory study titled Managing Chaos by Sacrificing Self: The Experiences of ICU Nurse Managers. When I speak of the intensive care unit, I am referring to an inpatient facility where care is provided to the sickest of patients. These patients may have suffered a traumatic injury, such as from a car wreck, and need interventions such as major surgery. Decisions at times have to be made quickly to save the life of the patient. This environment can be emotionally intense for the patients, families, and staff. ICU nurse managers play a key role in the critical care setting, balancing the needs of patients and the nursing staff they serve, as well as fulfilling their administrative responsibilities. Their job is critical as it influences nurse performance, the quality of care received of patients, and patient safety. Focusing on the well-being of the intensive care unit staff is a priority of the nurse manager as they experience their own stress and exhaustion as they balance their commitment to the organization and their staff and patients. Warden et al. Conducted a study of the turnover intention of acute care nurse managers in 2021, and 50% of the respondents stated they are considering leaving their positions in the next 5 years. The attrition of experienced ICU nurse managers from the nursing units affects the satisfaction and retention of experienced ICU nurses. In fact, a study by Boyle et al. In 1999 revealed that the relationship with their nurse manager can be a deciding factor in whether ICU nurses decide to leave or stay in their positions. To date, scant literature has been identified that addresses the day-to-day experiences of ICU nurse managers. With the sudden arrival of the COVID-19 pandemic, recent studies have focused on the experiences of ICU nurses and nurse managers during the pandemic. The research studies that have explored nurse managers tend to focus particularly on their role in supporting nursing staff to deliver quality patient care and their staffing decisions. The studies also have explored how nurse managers deal with staff turnover, staffing their units during crises, and how they address the needs of their nursing staff, including their emotional needs. While some studies have highlighted the experiences of various units, nursing directors, and chief nursing officers, few have focused exclusively on investigating the experiences of ICU nurse managers. Two recent studies identified issues faced by nurse managers, including the challenges that they have faced in their role and what occupies their time in their job. Both the American Organization for Nursing Leadership and the American Mobile Nurses Healthcare Study participants reported they spend most of their time dealing with the same issues, staffing their units and attempting to recruit and retain nursing staff. Participants in the AO1L study were asked their intention to leave their leadership positions in the next 6 months, with 12% of the study nurse managers responding yes. 31% of participants in the AMN study said they were planning to leave their role in the next year. When asked why they were planning to leave their job, participants answered the primary reason was the negative impact of the job on their health and well-being. Participants also reported the lack of resources to do their job as another reason for their intent to leave. Many cited the emotional and physical exhaustion related to the ongoing stressful working environment as one of the reasons they were planning to leave their positions. Previous research has focused on the effects of the nursing shortage in relation to the role of the nurse manager. Few studies could be located in the United States or worldwide that specifically examine the day-to-day experiences of ICU nurse managers. Furthermore, no classic grounded theory studies could be located that address the ICU nurse manager's experiences. the absence of literature regarding ICU nurse managers in general and their day-to-day experiences, as well as my observations of functioning within intensive care units, led to my curiosity about what the daily lives of ICU nurse managers are like. Therefore, this classic grounded theory study explored the day-to-day experiences of 11 ICU nurse managers. The theory that emerged from the study should provide insight and enhance understanding of the day-to-day lives of ICU nurse managers as they balance the competing demands of their patients, their staff, their own needs, and the demands of the hospital organization. This classic grounded theory study begins to close the gap by focusing on the experiences of nurse managers of intensive care units. This is the research question that guided my study. My aim was to address the gaps surrounding ICU nurse managers and their experiences managing their units. I chose Glaser's classic grounded theory approach for my study because little is known about the experiences of ICU nurse managers. The goal of a classic grounded theory study is to develop a theory from the study data that explains what is going on in the experiences of study participants related to the phenomenon of interest. The theory emerges during data analysis and reveals the main concern of the study participants and how they resolve their main concern. Classic grounded theory is an inductive research approach first described by Barney Glaser and Anselm Strauss and elaborated extensively by Glaser. Themes and patterns identified during the data analysis process allow emergence of a theory that is grounded in the study data. Glaser's approach really allowed the grounded theory to emerge from the data and then weave the relevant literature to the grounded theory. A total of 11 nurse managers who had been in their role for at least 6 months participated in the research study. 2 of the participants identified as male and 9 identified as female. The IC nurse managers in the study ranged in age from 32 to 56 years old, and participants' experiences as an RN ranged from 6 to 37 years. Their years of ICU nurse management experience ranged from 4 years to 24 years. The number of full-time equivalent employees that they were overseeing ranged from 24 to 82. And the total number of ICU beds the ICU nurse manager supervised ranged from 10 to 36. 1 participant had an associate degree of nursing, 7 had earned a Bachelor of Science in Nursing, 2 participants had a Master of Nursing degree, and 1 participant had a Doctor of Nursing and Philosophy. Doctor of Philosophy in Nursing. 9 participants practiced in the United States, and 2 of the participants were practicing in South Africa. 6 of the participants were from Texas, and then there was 1 each from Maine and Missouri. Data collection consisted of demographic data, recorded interviews, and that were conducted over Zoom, and also my memos. I utilized Otter AI for transcription of my data, and interviews utilized a grand tour question with follow-up questions and probes. Glaser says that classic grounded theory is an iterative inductive process that involves coding, constant comparative analysis, memoing, and sorting to generate a theory. Data analysis began with the first data collection session and continued throughout data collection and the writing process. Data analysis was a concurrent process of collecting, coding, and analyzing the data to generate a theory that allowed me to determine when and where to collect next to support the development of the emerging theory. Constant comparative methodology is a data analysis technique in which the data is collected and analyzed through all phases of classic grounded theory research. Constant comparative methodology began with a comparison of incident to incident of the data, which helped to identify conceptual codes that explained each of the concepts. Examination of the data items within each conceptual group led to clarification of the group's characteristics, so they eventually were refined to become categories with a label identifying each. Conceptual codes and categories were compared to each other during the refinement process. The use of constant comparative methodology also allowed the identification of patterns in the data, leading to conceptualizations of social patterns and structures that explain the nature of the relationship among the categories. Throughout data analysis, data was allowed to speak for itself, allowing the theory to emerge from the data. Each of the data analysis methods I employed allowed for a substantive theory to emerge from the studied data. The participants' main concern, which was the core category, managing chaos, emerged early in the data analysis process. After the core category was identified, I began selectively coding using constant comparative methodology while continuing to memo. Data analysis continued and sacrificing self emerged as the mechanism participants were using to resolve their main concern. Continued coding revealed no new categories, and so data collection was discontinued. Managing chaos by sacrificing self is a substantive theory that emerged from this study that explored the experiences of ICU nurse managers. The primary concern of the ICU nurse managers is managing the chaos that exists within and beyond their ICU units. Sacrificing self is how the ICU nurse managers manage that chaos. Managing chaos by sacrificing self consists of 3 subcategories: making it work, being stuck in the middle, and sacrificing self. For the ICU nurse manager making it work in their job, they must understand what being an ICU nurse manager entails, requiring them to be proficient at multitasking, able to assess situations quickly and make effective decisions, and be skillful in communicating with leadership and their nursing staff while serving as a liaison between the two. ICU nurse managers must understand the everyday workings of the hospital and the minute-to-minute dynamics of their specific units. Their goal is to keep the unit functioning at a high level to meet the needs of patients and their nursing staff. One participant commented, "There are frequently many fires to put out." They must know what is going on with their ICU patients, their patients' families, their nursing staff, and the availability of all the materials needed to provide care to the critically ill patients on their unit. The role necessitates a comprehensive grasp of everything happening within their unit at any given time. One nurse manager stated, "I must gather data and see what the dynamic of the floor is. I'm the supervisor, the ultimate director, so I need to see where we are at." Rounding on their patients and checking in to support their staff gives the ICU nurse managers first-hand insight into the patient's critical conditions, their care, and any potential or existing issues. In addition, checking in with their nursing staff allows the nurse managers to be available to create a supportive work environment and provide insight into the stressors and frustrations that are experienced by their nursing staff. The ICU nurse managers are aware that they may face unpredictable challenges and unexpected events that can disrupt even their best laid plans as the day progresses. One participant stated, "There are days where I cannot tell you what I did, but I was busy the whole day." Another participant said some days are spent only doing crisis management. Most of the nurses in the study said they often arrived early on at their units to get a head start on the coming day and check in with their staff members. Rounding is a meaningful way for nurse managers to support their staff and enhance patient care. Dealing with critically ill patients day after day can be challenging and exhausting for nursing staff. Their work is stressful, physically grueling, and emotionally traumatizing. Providing care to critically ill patients in an environment like the ICU and witnessing patients die despite exhaustive life-saving efforts can lead to a significant emotional toll on healthcare staff. Helping families cope with the loss of their loved one loved ones adds another layer of emotional strain. Being there for their staff members as they deal with the changing situation while providing required and expected care can be a challenge. One participant said, "I think part of our job is to absorb whatever the nurses are feeling or experiencing, whether it is an equipment that has failed or a fight between two humans. I want to absorb that emotional pressure for them." ICU nurses often face demanding and high-pressure environments characterized by complex medical cases and rapid patient turnover, requiring them to demonstrate exceptional skills, resilience, and adaptability in providing intensive care to patients who may or may not survive. The ICU nurse managers believe an essential part of their role is to fortify their nursing staff by supporting them as they navigate the emotional and psychological aspects of caring for ICU patients and their families. They also believe it is part of their role to help those staff members grow professionally. Managing the chaos of their jobs made the ICU nurse managers in this study oftentimes feel stuck in the middle between fulfilling their administrative responsibilities and attempting to fulfill their responsibilities to their ICU patients and nursing staff. Whether the ICU nurse managers in the study had moved into the position because they had applied for it or if they had taken the job temporarily, only one had received formal orientation to the position. When they assumed the position, they had found it to be unpredictable and had difficulty determining how to meet all the expectations and demands placed on them. ICU nurse managers come into their roles through diverse paths, with many ICU nurse managers having worked in various roles within the ICU, gaining expertise in patient care, critical thinking, and leadership skills over the years. 3 of the participants had been working as staff nurses on their respective units before applying for the job. One participant stated they were hired because the unit was desperate for a nurse manager. One commented, "I did not actually plan to move into a leadership position in nursing, or at least not nearly as quickly as I did." 4 of the study participants had been asked to step into the role as an interim and had remained in that role for a number of years. One participant said the extent of their orientation to the role was being given a sheet of paper entitled 10 Things Clinical Directors Should Do Every Day. Another described their experience. "I was asked one day if I would be interested in taking on the role, and the next day I was offered the position. I had no clue what I was doing. I did not have any orientation, so it was a challenge." One participant likened being thrown into the role as being thrown into a shipwreck that was on fire with the expectations that they would simply know how to keep the wrecked, burning ship afloat. 10 of the 11 study participants described their experience learning how to perform their role as being on-the-job training. The nurse managers said they are expected to work in an environment that is heavily administratively task-oriented while at the same time overseeing the care of critically ill patients. The ICU nurse managers who participated in the study revealed that managing the chaos of their jobs usually requires them to make significant personal sacrifices. The nurse managers in this study realized that to be considered a success in their role and do the job expected of them, they must do more and be more, including being available all the time. Their days are full of disruptions, their daily schedule is unpredictable, and they overload themselves to accomplish everything that needs to be done. They find the time to dedicate to all the demands and expectations by depriving themselves of personal time. They come to work earlier, they stay later, they work from home, and they do not take personal or vacation time due to them. One commented, "Sometimes it's easier for me just to keep going instead of taking time off." ICU nurse managers often work longer and more irregular hours, far beyond those of a normal shift. One commented, "I've worked 60 plus hours a week for the last 4 years. Working so many hours does not allow the nurse manager much personal time, and they sacrifice their own needs as well as those of their families and loved ones." When asked how they balance their work life with their personal life, one said, "I don't. Unfortunately, I don't." Even when they are not physically at work, their job demands the nurse manager's time and attention. One participant stated, "Just when you're off, you don't get to feel like you don't have things to do for work. I technically am not here, but I'm not ever technically all the way off because it's my unit." Study participants mentioned feeling guilty if they did not come to work early enough or stay at work late enough. One described the feeling saying, "You never lose the guilt when you're not at work. I feel like there is this perception that if I'm not there, that I'm not working." The nurse managers constantly struggled to meet the multitude of demands and expectations of their jobs, and it was common for them to find themselves at the end of the day having been unable to fulfill their plans. One study participant stated, "There are some days that I literally feel like I didn't do anything because I didn't even get to open up my emails." Being the nurse manager of an intensive care unit is complex and challenging. The result is ongoing stress. It was common for the nurse managers in the study to have considered or to be contemplating resigning from the job. One of the participants had already resigned the position. 5 of the nurse managers in the study spoke of wanting to resign their position at some point in their career, either in the past or in the future. One said, "I almost quit a couple of years ago. Recognizing that I did not have balance in my life caused me to consider leaving." One participant described their situation. "I really wanted to quit. I was exhausted and depressed, and my anxiety was off the charts, and I just didn't want to do this anymore. I really had to find a reason to stay and find the balance. I decided to stay because the staff deserved somebody who had been in their shoes and had worked next to them and will advocate and support them." The ICU nurse managers who considered leaving their jobs have decided to stay because they recognize their leaving could cause serious disruptions in their units and among their nursing staff. They describe a deep sense of responsibility for the well-being of their staff. One participant stated, "I didn't want to leave my unit. I love the people I work with and I didn't want to abandon them." The nurse managers are willing to continue in their job because they believe their staff rely on them. One participant described seeing them and seeing the trauma the ICU staff had endured during the chaos of COVID. "I was there. I saw their tears. I didn't want someone else to step in that didn't understand what they were feeling." Findings of the study in the substantive theory, Managing Chaos by Sacrificing Self, have implications for nurse managers, other nurses, and those in leadership positions in clinical facilities that rely heavily on ICU nurse managers to carry out part of the organization's mission and vision. The findings of the study and the theory may have relevance for other managers in other professional arenas. An important implication for ICU nurse managers and other nurses is the need to prioritize their own self-care. The ICU nurse managers are unable to provide sustained support to their nursing staff of their patients if they extend themselves to the point of no longer being able to sustain themselves. Nurses are often overextended emotionally and physically and unable to provide the same support to their patients and their patients' families. ICU nurse managers, as well as other nurses, must put themselves first. Then they will have more to draw from to do their job. It is noteworthy that one participant was able to set limits on the job and was able to establish and maintain boundaries between the job and their personal life. If one person can do it, perhaps others could as well. An additional implication of this study was exemplified by one participant who recognized the need to have a succession plan. That participant deliberately set out to nurture leaders and nurture leadership skills and create a unit of nurse leaders. Unfortunately, ultimately, those nurses whom the participant had nurtured will be able to ensure continuity of leadership within the original unit and potentially take on leadership roles in other areas of the hospital. There are some important implications from this study for leadership in hospitals that employ the highly skilled and knowledgeable nurses to manage their intensive care units. The need for adequate orientation, ongoing mentorship, and clear expectations in the job was evident in this study. The need to know what to do in their job and where to turn for help was also evident in the study. All but one of the study participants mentioned not receiving an appropriate orientation or training to meet the expectations placed on them to lead a unit with patients experiencing such critical and consequential conditions as the ICU. The lack of information provided to participants upon being hired into the nurse manager job meant many had to struggle to understand what was expected of them and how their work contributes to the overall objectives of the organization. Such support would increase the probability of the ICU nurse managers being successful and remaining in their positions. Leadership should also consider ways to provide education and support in formats other than face-to-face meetings. For example, making materials accessible in an asynchronous format would allow the ICU nurse managers to receive the information when their schedule allows, rather than asking them to sit through meetings. None of the participants in this study described the existence of policies guiding nurse managers' practice within their ICUs. Rather, they operated under unwritten rules passed from nurse managers and important guidance and training of how to access different programs and systems nurse managers might need to perform their jobs. Study participants prioritized attending to the nursing staff's needs and ensuring that patients received appropriate care in their units. Nevertheless, the time they were required to spend away from their staff and patients, attending meetings, and performing miscellaneous tasks that others in clerical roles could do caused them a great deal of frustration. The ICU nurse managers in the study found many of their administrative tasks were cumbersome, requiring them to spend extended periods of time in various computer software systems to complete reports and justify the needs of their units. The ICU nurse managers in this study seemed to find some of their greatest joy in helping their nursing staff provide quality care to their patients, but one of their greatest frustrations was the amount of time they are being pulled away from the job to address the requests of those outside the ICU. The study underscores the crucial role of leadership support in recognizing and addressing the needs of new ICU nurse managers. Individuals in leadership positions above nurse managers in the hierarchy should be aware that their nurse managers may become so exhausted that these extremely valuable and knowledgeable nurses are not lost to them. Leadership also could offer education for new nurse managers regarding self-care and how to manage issues that may result in their working overtime, such as helping staff their units due to short staffing. Education could be integrated into support group sessions to offer a safe place for discussion for the nursing staff and nurse managers. One of the important points that emerged from this study is the participants' belief they should be on their units helping their staff rather than attending the numerous meetings that fill their calendars. They expressed frustration at being unable to do the job that they were hired to do, which is to make sure their units are functioning well. Freeing up these nurses so they can utilize their expertise to look after their staff and their patients is an important implication for nursing leadership. Keeping the ICU nurse managers away from their units ultimately means the hospitals being deprived of their knowledge and expertise. This study has implications for nursing programs that prepare nursing students to enter the healthcare workforce. Nursing programs could offer education on self-care to help prepare nursing students for the long hours and emotional demands that they will face as new graduates and new nurses. Students could also benefit from management competencies for the hospital context to help prepare them to work effectively in future management positions. The current study is the first study to examine ICU nurse managers' experiences managing their units, and classic grounded theory has never been used to explore the experiences of nurse managers, including ICU nurse managers. The study used real data from current or recent ICU nurse managers actively practicing in the ICU. The study fills gaps in the nursing literature by offering the substantive theory, Managing Chaos by Sacrificing Self, that explains what ICU nurse managers experience and what they must do to perform in their job. The study also highlights the commitment the ICU nurse managers have to their nursing staff, their patients, and their patients' families, and how their commitment causes them to sacrifice self to meet all their needs. Healthcare organizations, nursing education, and nurse managers can utilize the substantive theory that emerged from the study data to offer guidance for institutions and their leadership on how to support and encourage their ICU nurse managers and ultimately retain these knowledgeable and skilled nurse managers. Additionally, the current study offers insight regarding the need to adequately orient ICU nurse managers to enable them to have a better understanding of the job that is expected of them. The study participants were from several geographic locations, allowing for diversity of the study participants and richness of the study data. Although there were only 2 males in the study, this is a higher percentage than the number of males in the nursing profession, which is currently 12%.